Hi, my name is Sharon Jaske, and I want to talk about adverse childhood experiences and the hidden national crisis. I want to start out by talking about U.S. healthcare spending, then discuss our healthcare outcomes and compare those outcomes to other countries. Then I want to talk about the landmark findings of the Adverse Childhood Experience Study and give examples of best practices. How is money spent by the U.S. government? The United States spent $2.9 trillion, or 17% of the overall U.S. expenditures for the fiscal year 2013 on health care, a large portion of that on Medicare and Medicaid. It's any wonder that health care has long been a topic of national debate, even before the Affordable Health Care Act was enacted, or the Illinois governor's often criticized proposal for a $1.5 billion cut in Medicaid. What are our healthcare outcomes, and how do those outcomes compare to other countries? Outcomes such as the quality of life and healthy development are difficult to measure, but may be reflected in life expectancy, mortality rates, or the prevalence of health conditions. Looking at the life expectancy at birth measure and comparing the U.S. with economically similar countries, we find that life expectancy in the U.S. is just under 79 years, compared to an average of just under 82 years in comparable countries, falling short by nearly 3 years. This is only one measurement. Further research in fact shows that the U.S. falls short in 9 measurable health categories, similar to those depicted here. Our national health objective is obviously and simply stated to get healthy when we become sick or injured. A better, more cost-effective objective would be to avoid getting sick in the first place. We all know that smoking increases your risk of lung conditions, and obesity increases your risks of a slew of health problems. But could we have better health outcomes if we understood what increases the likelihood of smoking or the likelihood of becoming obese? Could we prevent these conditions from occurring rather than the costly treatments after the fact? There is growing evidence that we could. A 1997 collaborative study between the Center for Disease Control and Kaiser Health Clinic in San Diego looked at 17,000 participants, combining their current health conditions with survey answers to questionnaires regarding childhood maltreatment. From this survey, the study identified 10 adverse childhood experiences, we'll call them ACE, and categorized them under 3 general types: abuse, neglect, and household dysfunction. The study revealed that ACEs were common. Nearly 2/3, or 64% of participants, experienced at least one ACE, while 12% of the population experienced 4 or more ACEs. In addition, they found a direct link could be identified between the total count of ACE and multiple risk factors for several leading causes of death, including smoking, obesity, heart disease, and cancer. Typical in the ACE literature is a stair-step graph depicting the correlation between the prevalence of ACE and well-being. The more incidence of ACE, the more likely one is to have particular health conditions. Persons with 4 or more ACEs had 4 to 12 times the increased risk of alcoholism, drug abuse, depression, and suicide attempts. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of heart disease, the #1 killer in the United States. The study developed a lifetime conceptual framework depicted in this pyramid. Most of the attention given to child abuse prevention was concentrated on social sciences or the mental health fields, and scientific research on early childhood brain development related to chronic childhood stress was incomplete at the time of the study. That's indicated here in the scientific gaps. Recent breakthroughs, however, are reducing this gap. We now have a clearer understanding of how toxic stress affects the brain structure and function, how it affects the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed, altering health outcomes long into adulthood. Preventing ACE is an alternative solution to the local and national debate regarding health care costs. We've defined the problem. We've identified the risks and the protective factors, and we're in the process of developing and testing preventive strategies. The Family Center in Tennessee concentrates on parent education with outstanding results. California, in November of 2014, held its first ever summit on addressing ACE treatment. Bringing this hidden crisis to the forefront of the national conversation could produce policy and procedural changes, enhance research, and promote best practices that could make the effects of ACE as benign as polio. Let's hope it does. Thank you.